Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is Dr. Damaris Maria Grossman, your Integrative Family DMP. And today we're talking on Mindfully Integrative Show. The Mindful Public Health Tip and health discussion is actually on pancreatic cancer awareness. And this November, Pancreatic Cancer Awareness Month, it's a near and dear to my family and to my heart. I have some family members in my life that have had pancreatic cancer. And I really believe that it is something that it's not necessarily that it's preventable, but it has some components of managing and some components of hopefully decreasing the risk. So I'm going to talk about a little bit about that today. And my resources I will send and have in the links in the show notes and of what we're going to discuss. So overall, pancreatic cancer is a very hard diagnosis. It is in affects, and it's also fairly rare. It's approximately 3 to 4% of people have it inherited. But then there is also a mutation of a BRCA1 and BRCA2, can also be a component in the family history. Other components and risk factors that people do not know and are finding out in addition to a genetic component is that there is actually risk accelerators to pancreatic cancer, and there are other components, especially diet and lifestyle management, risk factors that can increase the opportune possibilities of tumors or cells reforming and causing a pancreatic cancer. So these lifestyle habits, which actually can be managed, and this is the reason why one of the parts of why I'm talking about this is that it is such a debilitating cancer and a diagnosis that is so significant to families and loved ones that I don't want those to have to deal with this. And if they are, my love and support and guidance and faith for them to get through each and every day is so important. But for those that may feel that they may be in a family genetic component, there are lifestyle risk components. So one is, I'm getting these researches from Sloan Kettering Cancer Institute research, and the number one is smoking or tobacco use. Age, usually pancreatic cancer is usually over the age of 55. Race and ethnicity, it ranges mostly in African Americans, can also develop in Hispanics, Caucasians, and Asians. Obesity is a big factor. So when you have a higher BMI, which is a body mass index over 30%, you have a greater component of having pancreatic cancer. Diabetes is a factor. Having type 2 diabetes will also increase your risk because you have to think the pancreas is overworking. And in turn, there might be excess cell growth, chronic pancreatitis that can be caused due to excess smoking, drinking, diet, fat, and other areas. In addition, there's components of environmental. These components of carcinogens, pesticides, asbestos, depends upon work environment. Those can be factors. What exactly is pancreatic cancer? What is the pancreas? So the pancreas is a small gland in the abdomen that is used, also called the exocrine cells, to secrete hormones, especially insulin. And what happens is there are so many actually different types of pancreatic cancer. It's close to like 20 different types of tumors that can be found in the pancreas and or cysts. So not all of them are serious and some are. The less common tumors are those that arise in the cells of the pancreas called islet cells. And they're called islet cell tumors, or this is called a neuroendocrine tumor. A little bit more complex and within the bile duct. Now, the most important part of pancreatic cancer is detection early. So, this awareness and mindful public health chat is to trying to identify and diagnose something like this rare or one of the possibilities of this early on so that you can get the treatment, surgery, or medication, or chemo, or diagnosis at the earliest stages. So, as I previously discussed, the initial lifestyle management, that's just one component, the risk factors. So, here, as a provider and talking a lot on the functional health side, I'm always wanting you to prevent cancer and prevent disease and prevent these ailments within the body. And as I had stated, yes, there's a genetic component, but then there's all these other risk factor components. In addition, when you talk about lifestyle management and foods, cancer loves sugar. So when you start decreasing the sugar within the body, it will help with prevention. So your diet and your overall management is still part of this healing process. So, what are signs that may be pancreatic cancer or may be something that is troublesome within the pancreas or within the body that you need to go make sure that you take precautions? The difficult part about pancreatic cancer and the pancreas is that there is not some full early warning signs, but because it has very similarities to maybe an upper abdomen pain, you may have some nausea, vomiting, weight loss, you may have some burning or indigestion. A lot of certain foods, fatty foods, may cause some greasiness in the stool. And then more serious issues would be yellowing of the skin and whiteness or the yellowing in the eye area. And this is due to the tumors blocking the bile duct within your body and then is causing a backup within the liver. So this is quite serious, and that's one of the later signs that, we hope to not have it, but this is, a part of the awareness and the overview. So how is this diagnosed? So initially you might go to the doctor, get your annual exam, and you might have some upset stomach. Could be a gallbladder issue, could be just an upset stomach, but overall, it's always best to still get your yearly checkups with your provider. Let them know what's going on. Give them an insight of where your diet has been. Give them an insight of where your stress and your levels have been, and see what you can do to make adjustments. Now, there are numerous amounts of tests, and this is just kind of the general overview. And then obviously it's going to be more extensive as you go and seek specialists. So you're going to get blood tests, and the blood tests that you can check for, at least with your doctor, is a hepatic liver function test, and that can be done in an annual exam. And if that is elevated or there is some indication of some sort of, in addition to pain, further testing is needed. Initially, maybe just going to an internist or a GI specialist, then need a hepatologist. There's another components of blood tests called the CA19-9 or carcinoembryogenic antigen. Those two tests are a little bit more specific, and usually specialists will order them. But if you're going to your provider initially, usually a liver enzyme test, pain, symptom management, And diagnostic imaging that may be needed will be like an ultrasound, a CT scan, or so their endoscopic ultrasound. But that would be another component. And what I'm trying to do is trying to give you just be aware of the symptoms, what is going on within your body, and if you have a genetic component. And then, of course, there's an additional biopsy and pathological needs for that patient. With all stages of cancer, there is a 1, 2, 3, and 4. So that really depends upon how large these tumors are, if they're growing outside of the pancreas, if they have moved to nearby vessels or nerves, or if they have actually gone to the liver or other parts of the abdomen. And that does change in treatment. I'm here to just give a general overview because of the severity of pancreatic cancer and the importance of us just to have a base knowledge so that we can help our family members, our loved ones, and those that may need assistance and resources. I'm just sending you to the Memorial Sloan Kettering Cancer Center resources and just advocate for those that may be dealing with this. And the screenings for this is super important, especially if you may think that you may be in a high risk category, diabetes, food intake, your fatty liver, something like that, unexplained weight loss, may now have a new diagnosis of abdominal pain or diabetes. These may be things that, there is something further going on. And then, of course, a late stage there is maybe even a jaundice or a yellowing of the skin. So I'm just here to kind of give you a general overview and to see if you can just have some resources and available ways to get access to care. Another amazing thing that has come up due to the research is there's more clinical trials, immune therapy. There's even came up a pancreatic cancer vaccine trial. It's quite amazing. I know that it's quite new, so I can't really talk much in it. I just, from what I have read, it is using the mRNA vaccine, and it is helping with building up your immune system, and hopefully with more research and more trials, this will be something where a vaccine may be a component of helping alleviate some of the types of pancreatic cancer. So this is the end of this call or this podcast and show. If you have any questions, feel free to reach out. I'll put in show notes, resources, and different articles that I've had that I'm reading on. And if you like any more information, please feel free to reach out. So make sure you find a mindful way each and every day. And that's today's mindful public health awareness. Thanks so much for listening. Have a great day, or whatever time it is for you.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.